Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another knowledge booster dose, that is knowledge booster dose part 26. In this video we are going to see pinpoints from pharmacology, particularly important points from toxicology part of pharmacology, reasons for different poisons and their antidotes, some poisoning and their symptoms along with the treatment. So this part is very important for your upcoming GPAT Niper Drug Inspector and Government Pharmacist exam. I would like to request you please watch this video until end. My dear students, we have already seen 25 parts of knowledge booster dose. If anybody has not seen previous knowledge booster dose parts, please go in the channel's playlist and watch all the previous videos because they are really important for your GPAT Niper DI Pharmacist exam. And believe me, lot of MCQs they are going to be covered just by watching those videos. My dear students, first of all you should know what do you mean by poisoning and what are the reasons for poisoning. So poisoning is nothing but it is a symptoms when you ingest any kind of poison. अगर आपने कुछ poison substance खा लिया सो आपको उसमें symptoms आएगा and that symptoms जो है उसको क्या बोलेंगे poisoning. So poisoning if untreated may be fatal and it can lead to death. Poisoning अगर आपको ट्रीटमेंट नहीं मिला टाइम पे तो आपका देहांत भी हो सकता है. So what are the reasons for poisoning? Basically, first reason is nothing but the accidental, or you can say accidental poisoning. Now why there is accidental poisoning? If you don't know about the poison, suppose आपने कुछ बॉटल ले लिया, आपको मालूम ही नहीं कि उसमें पॉइजन है और आपको लगा कि पानी है, आपने पी लिया. So that is a type of accidental poisoning. So if you don't know about, if you are not aware about that poison is there in that particular container and if you eat or if you drink that, so that leads to accidental poisoning. You don't know about the poison, so that is accidental poisoning. जैसे आपने कोई बच्चे ने जैसे चूहे मारने का केक खा लिया तो उसको क्या लगा कि ये बिस्किट है या फिर कोई केक है, लेकिन उसने चूहे मारने का केक खा लिया. सो एक्सीडेंटल पॉइजनिंग. बच्चों को क्या मालूम हो कि ये क्या है. So accidental poisoning. Second reason of poisoning is nothing but the occupational poisoning. So what do you mean by occupational poisoning? So occupation means business. Occupational poisoning means poisoning due to business or poisoning due to working in the particular business. So this type of poisoning particularly happens with the farmers. So occupational poisoning ज़्यादा किसमें होता है? Farmers में होता है. जैसे you can see farmers they used to spray pesticides to prevent their crops. Farmers they used to spray pesticides to prevent their crops from pest. Now during the spraying of pesticides, so if there is no protection on the skin, if there is no protection on the eyes, so if farmer is not protecting his full body, eyes, etc., so what will happen? So spray of this pesticide, so if there is a change in the direction of wind, so what will happen? This spray may spread or this spray may get dropped on a farmer's face or farmer's skin. Now all these pesticides they are known as organophosphorus compounds. जो pesticides होते हैं वो organophosphorus compounds होते हैं. They are highly lipid soluble compounds and even they can get absorbed from your skin. And if there is change in the direction of wind, so this spray may be on the face and body of that farmer and that leads to poisoning. Now Indian farmers they don't take much care about during their working. Indian farmers जो इंडिया में होते हैं वो पूरा जैसे इनरवियर्स के ऊपर ही रख के स्प्रे करेंगे. तो क्या होता है कि कभी कभी ये स्प्रे उनके ऊपर आ जाता है. अगर वो स्प्रे उनके ऊपर आ गया तो उसका पेस्टिसाइड जो है वो एब्सॉर्ब होगा और पॉइजनिंग करेगा. जैसे फॉरेन फार्मर होता है दे यूज्ड टू टेक फुल केयर ड्यूरिंग द स्प्रेइंग. जैसे इसने पूरा बॉडी को ढक लिया है, इसमें मास्क लगाया है, इसने गॉगल लगाए. सो ऑक्यूपेशनल पॉइजनिंग रिलेटेड टू बिजनेस और मोस्टली इट इज हैपनिंग विद द फार्मर्स. नाउ थर्ड काइंड ऑफ पॉइजनिंग और थर्ड रीजन ऑफ पॉइजनिंग, दैट इज अ suicidal poisoning, suicide intent. So third type of poisoning is nothing but the suicidal poisoning or suicidal intake. Now this is due to the suicide. So if you want to do suicide, Suppose somebody has broken your heart and you don't want to live. So in that case you are taking poison or you are taking any poisonous substance to kill yourself. So that is a suicidal poisoning. So accidental poisoning, occupational poisoning, suicidal reason, suicidal poisoning. Reason for poisoning is nothing but the homicidal. Homicidal means intent to kill, intent to murder. So if anybody wants to murder you and he gives you poison forcefully, so that kind of poisoning is known as a homicidal poisoning. So poisoning, reasons of poisoning or different kinds of poisoning. Accidental, it may be either accidental or it may be either occupational, it may be suicidal or it may be homicidal. So there are the reason, different reason. Another kind of poisoning is there, drug poisoning. Drug poisoning is mostly because of the overdose of drug. Drug poisoning is because of the overdose of drug. Now we will see the different type of drugs which act as a poison. There are antidotes which are very very important, and believe me, lot of times they have already asked question on this. We'll see first antidotes. Antidotes for emergency treatment. Antidotes for emergency treatment of certain poisoning. So drug poisoning, then antidote, drug poisoning and antidote. So first drug is nothing but the paracetamol. So if you get a poisoning due to paracetamol, what is the specific antidote? पैरासिटामोल का अगर पॉइजनिंग हो गया आपको, तो पर्टिकुलर एंटीडोट क्या है? एन एसिटिलसिस्टीन एंड मिथियोनिन. सो पर्टिकुलर एंटीडोट फॉर और स्पेसिफिक एंटीडोट फॉर paracetamol poisoning is nothing but the n acetylcysteine and methionine. Now when there will be paracetamol poisoning, कब हो सकता है? When you take 6 gram per day. Paracetamol is toxic in a dose of 6 gram per day. So if you take paracetamol beyond 6 gram per day, that leads to paracetamol toxicity, and antidote is nothing but the N-acetylcysteine and methionine. These both are the sulfur containing amino acid. They used to increase the glutathione level of your body. Increase in the glutathione level will decrease the toxic metabolite of paracetamol, that is a N-acetylbenzoquinone imine. Second, if you get a poisoning due to heavy metals like mercury, arsenic and copper, so in that case this is the antidote. Bal is a specific antidote, or it is known as a dimarcaprol. Dimarcaprol is a specific antidote for arsenic, mercury and copper poisoning. Now in case of atropine poisoning or poisoning due to other anticholinergic drugs, so physostigmine is the specific antidote for atropine poisoning or poisoning due to anticholinergic drugs. Now you can say atropine is a specific antidote for physostigmine and physostigmine is a specific antidote for atropine. तो atropine poisoning हो गया तो physostigmine antidote है, antidote physostigmine. अगर physostigmine का poisoning हो गया तो atropine antidote है, atropine poisoning हो गया तो physostigmine antidote. So they are the antidote for each other. Now if you get a poisoning due to carbon monoxide का poisoning अगर हो गया, so in that case oxygen is a specific antidote. Hyperbaric oxygen, बहुत ज़्यादा प्रेशर से ऑक्सीजन देना. Now in case of cyanide poisoning, अगर cyanide poisoning हो गया, so what is the specific antidote? Dicobalt EDTA, amyl nitrate followed by sodium nitrate and then sodium thiosulfate. So remember, amyl nitrate, sodium nitrate and sodium thiosulfate, these are the antidote for cyanide poisoning. So every poisoning will have its own symptoms, the mechanism of action of antidote. So that is the beyond the scope of this session, that will be seen in upcoming session. Okay, if you get poisoning due to मिथेनॉल का poisoning हो गया या फिर इथिलीन ग्लाइकोल का poisoning हो गया, so in case of poisoning of methanol, ethanol is antidote, and in case of ethylene glycol poisoning, 4-methylpyrazole, that is known as a fumipazole, that is used as an antidote, specific antidote. Now in case of lead poisoning, what is the antidote? Calcium disodium EDTA and dimarcaprosuccinic acid. लीड का पॉइजनिंग अगर हो गया तो कैल्शियम डाइसोडियम EDTA, dimarcaprosuccinic acid, they are the antidote. In case of nitrite poisoning, nitrites poisoning, methylene blue is the specific antidote. In case of opioid poisoning, in case of opioidal drugs like morphine, codeine, thebaine, जो opioidal and analgesic होते हैं, narcotic analgesics. So in case of narcotic analgesic poisoning, a narcotic antagonist known as a naloxone, it is a specific antidote for opioidal poisoning. On this they have already asked question. On the cyanide poisoning they have already asked question. On the heavy metal poisoning they have already asked question. On the paracetamol also they have already asked question. Okay, drug poisoning, benzodiazepine poisoning, in that case flumazenil is the specific antidote. So benzodiazepines they are nothing but the sedative hypnotic anticonvulsant drugs, and in case of overdose or in case of poisoning of this benzodiazepine, flumazenil is a benzodiazepine receptor antagonist. It is used as an antidote for benzodiazepine poisoning. Now this was also question in the various exams. Now again, next poisoning, organophosphate poisoning. So if you get organophosphate poisoning, organophosphate compounds means pesticides. So pesticides they are nothing but the organophosphate compounds, and if you get poisoning due to organophosphate compounds, atropine and pralidoxime, these are the antidote. So specific antidote for organophosphate poisoning is nothing but the pralidoxime. You have to remember this. There was a question. Now pralidoxime is nothing but the, it is known as a cholinesterase activator. ये क्या करता है, cholinesterase enzyme जो है उसको activate करता है. Now why there is need of cholinesterase activator? Organophosphate compounds they are known as a irreversible inhibitor of cholinesterase. तो cholinesterase क्या होता है? Cholinesterase is the enzyme which metabolizes the acetylcholine. ठीक है? So that is inhibited by this pesticides. Now if that cholinesterase is inhibited, that means metabolism of acetylcholine will not be there in the body. So acetylcholine level will increase, it will be accumulated, it will act on its receptor, it will cause increase in the secretion, bronchial secretion and all kind of secretion. So there is a decrease in the heart rate and all the complications. So okay, so that's why you have to activate that cholinesterase enzyme so that acetylcholine will be metabolized, excessive acetylcholine. Now pralidoxime is the known as a 2-PARM, that is a cholinesterase activator, and that is used in the poisoning of organophosphate compound. So pralidoxime is a specific antidote for organophosphate compound. You have to remember pralidoxime is a specific antidote for organophosphate poisoning. Okay, pralidoxime. In case of heparin poisoning, what is heparin? Heparin is nothing but the, it is an anticoagulant, natural anticoagulant present in the blood. It is the most acidic compound. So if there is a poisoning due to heparin, so antidote for heparin poisoning is a protamine sulfate. Now what is protamine sulfate? Protamine sulfate क्या होता है? It is a basic compound. Heparin is a acidic compound and protamine sulfate is a basic compound. Remember heparin poisoning में antidote होता है प्रोटामाइन सल्फेट. इसके ऊपर क्वेश्चन आ चुके हैं, राइट? नाउ विल सी द नेक्स्ट. इन केस ऑफ ट्राइसाइक्लिक एंटीडिप्रेसेंट पॉइजनिंग, ड्रग पॉइजनिंग ड्यू टू ट्राइसाइक्लिक एंटीडिप्रेसेंट. So drugs, for example, imipramine, desipramine, amitriptyline, nortriptyline, they drugs belongs to tricyclic antidepressant. अगर in case of tricyclic antidepressant poisoning, sodium bicarbonate is the drug, or it is an antidote for tricyclic antidepressant poisoning. If there is a poisoning due to this methamoglobin poisoning, antidote is a methylene blue. In case of poisoning of ethylene glycol, antidote is nothing but the fomepizole. In case of methanol poisoning, ethanol can be used as an antidote. Now in this case, ethanol can be used as antidote in the methanol poisoning. Why? There is a reason कि ethanol क्यों यूज किया जाता है methanol poisoning में. You have to understand the metabolism of this alcohol. Methanol is metabolized by alcohol dehydrogenase first and converted into formaldehyde, and after that metabolized by aldehyde dehydrogenase converted into formic acid. Now ethanol is also metabolized by alcohol dehydrogenase and converted into acetaldehyde, and acetaldehyde is converted into acetic acid by the aldehyde dehydrogenase, right? Now this is a sequence of metabolism. Now in case of methanol poisoning, so there is a conversion of formaldehyde and formic acid sequentially. Now that formic acid accumulated in the body, and that causes the severe symptoms of poisoning of methanol. Now in case of methanol poisoning, ethanol is given. So what will happen? Ethanol will compete with the methanol for the alcohol dehydrogenase, and that's how methanol toxicity can be reduced. So formic acid, formaldehyde, they are very poisonous as compared to acetic acid and acetaldehyde. So that's why ethanol can be used in the methanol poisoning. Now next iron poisoning, or iron poisoning. So iron, in case of iron poisoning, specific antidote is a desferoxamine. Specific antidote क्या है? desferrexamine. Now, iron poisoning mostly happens or mostly it is seen in the children's. जो बच्चे होते हैं उनमें ये आयरन पॉइजनिंग बहुत ज्यादा होता है. क्यों होता है? जैसे होता है जो कोई प्रेग्नेंट लेडीज है या फिर कोई माँ है, उस उनको क्या होता है कि आयरन का टैबलेट्स प्रेस्क्राइब किया होता है टू ट्रीट द एनीमिया. नाउ इन दैट केस बच्चों को मालूम नहीं होता कि क्या है, टॉफी है या फिर गोली है, तो वो खा लेगा गोली. सो इवन accidental ingestion of 10 tablets of iron, dose corresponding to 1 gram of iron or iron, that is a that leads to iron poisoning. Even 1 gram of iron leads to poisoning. Now in that case desferrexamine is a specific antidote. You have to remember there was a question in the exam. Now in case of insulin, antidote is nothing but the glucose. Insulin kya hai? It is a pancreatic hormone secreted by beta cells of Langerhans. Okay, function of insulin is nothing but the to utilize the glucose, so in case of insulin it is used in the diabetes mellitus, insulin dependent diabetes. So in case of overdose of insulin or poisoning of insulin, glucose is used as an antidote. अगर इंसुलिन का ओवरडोज हो गया तो ग्लूकोज देना है, इंट्रावेनसली ग्लूकोज दे दो, या फिर इंट्रावेनस में नहीं दे सकते इमीडिएटली तो आप ग्लूकोज दे दो, उसको शक्कर खाने को दे दो. ठीक है. नाउ इन केस ऑफ कैल्शियम चैनल ब्लॉकर्स पॉइजनिंग, so calcium channel blockers, they are used as anti-hypertensive drug, anti-arrhythmic drugs, etc., etc. So calcium channel blockers, in that you have verapamil, diltiazem, amlodipine, nifedipine, etc., etc. So in that case calcium is used as a specific antidote, or glucagon or insulin is used as an antidote. In case of aspirin poisoning, sodium bicarbonate is used as an antidote. Aspirin will causes systemic acidosis. एस्पिरिन का पॉइजनिंग अगर हो गया तो एसिडोसिस हो जाएगा, एंड टू डिक्रीज दैट सोडियम बाइकार्बोनेट इज अ बेसिक कंपाउंड. इन केस ऑफ पॉइजनिंग ऑफ बीटा ब्लॉकर्स, फाइसोस्टिग्माइन इज द एंटीडोट. इन केस ऑफ पॉइजनिंग ऑफ हाइड्रोफ्लोरिक एसिड, कैल्शियम ग्लूकोनेट इज द एंटीडोट. इन केस ऑफ methotrexate poisoning, leucovorin is the antidote. Methotrexate is nothing but the anti-cancer drug. It is known as an anti-metabolite, and it is a folate antagonist. It will prevent the synthesis of folic acid in the cell, and this property also leads to hazardous effect on normal cell, or normal cell will have poisoning due to methotrexate, and in that poisoning leucovorin, or it is also known as a leucovorin citrovorum factor, or folinic acid, N10 formyl folic acid, that is known as a folinic acid or leucovorin citrovorum factor. Now it is used as an antidote for methotrexate toxicity or methotrexate cell injury. Okay, so it is known as a leucovorin rescue. इसको बोलते हैं leucovorin rescue, क्योंकि methotrexate क्या करता है, फोलिक एसिड एंटागोनिस्ट है, फोलिक एसिड को सिंथेसाइज नहीं होने देगा, तो सेल में फोलिक एसिड नहीं बनेगा तो डीएनए आरएनए सिंथेसिस नहीं होगा, वन कार्बन एटम ट्रांसफर चेन रिएक्शन नहीं होगी. कैंसर सेल तो मर जाएगा, लेकिन नॉर्मल सेल में क्या होगा कि इसका डेफिशिएंसी हो जाएगा और सेल को शॉक लग सकता है, सेल मर सकता है. So in that case methotrexate toxicity, leucovorin citrovorum factor or folinic acid is used to prevent the toxicity of methotrexate, known as a leucovorin rescue. Now in case of coumarin anticoagulant, antidote is a vitamin K. Coumarin anticoagulant, they prevent the synthesis of, or they prevent the activation of various blood clotting factors which are coupled with the vitamin K epoxidation. So in that case coumarin anticoagulant का toxicity हो गया तो vitamin K is a antidote. We'll see these things again. Different compounds or different drugs, their signs and symptoms of poisoning, different drugs, signs and symptoms of poisoning, treatment or antidote, interventions or antidote. So first is nothing but the first one is acetylcholinesterase inhibitors. So they are nothing but the रिवर्सिबल एसिटिलकोलिनेस्टरेज इनहिबिटर्स एंड इरिवर्सिबल. तो रिवर्सिबल वाले जो होते हैं जैसे फाइसोस्टिग्माइन, पिरिडोस्टिग्माइन, अम्बोनियम एक्सेट्रा, एंड इरिवर्सिबल वाले जो होते हैं ऑर्गेनोफॉस्फेट कंपाउंड्स. एसिटिलकोलिनेस्टरेज इनहिबिटर का पॉइजनिंग हो गया, सो दैट लीड्स टू सिम्टम्स क्या होंगे, मायोसिस, पिनपॉइंट पिपिल, सलाइवेशन, स्वेट, एक्सेसिव स्वेट एंड सलाइवेशन, मायोसिस, गैस्ट्रोइंटेस्टिनल क्रैम्प्स हो जाएगा, डायरिया हो जाएगा, मसल ट्विचिंग, seizures, coma and respiratory failure. So in that case respiratory support will be there, atropine and pralidoxime. Pralidoxime is a specific antidote Okay, for irreversible acetylcholinesterase inhibitor. Pralidoxim is a specific antidote for irreversible acetylcholinesterase inhibitor. कौन है? Pesticides. Pesticides are irreversible acetylcholinesterase inhibitor. Poisoning due to atropine and muscarinic blockers. So what are the symptoms? So increase in the heart rate, increase in the blood pressure, hyperthermia, hot, dry skin, delirium, hallucination, mydriasis. So atropine poisoning we have seen antidote is nothing but the physostigmine. So you have to control the cardiovascular symptoms plus hyperthermia, and you have to use physostigmine, which is a specific antidote for atropine poisoning. Now third one is nothing but the carbon monoxide poisoning. If more than 10% of carboxyhemoglobin are there, so that leads to nausea, vomiting, dyspnea. Dyspnea means unable to breathe. Okay, hyperventilation, mydriasis, vertigo, cardiovascular signs like decrease in the blood pressure, syncope, increase in the heart rate, and arrhythmias. So in that case, antidote is nothing but the hyperbaric oxygen. अगर कार्बन मोनोऑक्साइड का पॉइजनिंग हो गया तो हाइपरबारिक ऑक्सीजन इज द एंटीडोट. पॉइजनिंग ड्यू टू सीएनएस स्टिमुलेंट जो ड्रग्स होते हैं, सो इन दैट केस जैसे आपका कैफीन, थियोफाइलिन हो गए, या फिर आपका बाकी कोकेन वगैरह सीएनएस स्टिमुलेंट, सो दे कैन कॉज एंजाइटी, एजिटेशन, हाइपरथर्मिया, mydriasis, increase in the heart rate, blood pressure, psychosis, and seizures. So in that case, you have to control the cardiovascular symptoms, hyperthermia, and CNS symptoms. Now it is due to CNS stimulation. जो भी symptoms आ रहे हैं, that is due to excessive CNS stimulation. तो आपको depression drug use करना पड़ेगा. So in that case, benzodiazepines or antipsychotic drugs, they are the drug or they are the antidote or treatment. Now in case of opioidal analgesic poisoning, opioid का poisoning अगर हो गया, so that leads to lethargy, sedation, decrease in the heart rate, decrease in the blood pressure, hypoventilation, meiosis, coma, and respiratory failure. So you have to use specific antidote for opioids, that is naloxone or naltrexone or nalbuphine. If you got a poisoning due to acetyl salicylic acid, so क्या होगा? acetyl salicylic acid, एस्पिरिन का poisoning हो गया तो symptoms क्या? Confusion, lethargy, hyperventilation, hyperthermia, dehydration, hypokalemia, acidosis, seizures, and coma. So correct the acidosis by using electrolyte or sodium bicarbonate. Urinary alkalizers are used. अगर पॉसिबल है तो हीमोडायलिसिस भी कर सकते हो. नाउ इन केस ऑफ सेडेटिव, हिप्नोटिक और इथेनॉल पॉइजनिंग, सो सिम्टम्स क्या होंगे? सिम्टम तो सेम ही होते हैं सेडेटिव हिप्नोटिक्स के, पॉइजनिंग के और इथेनॉल पॉइजनिंग के. सो डिस इनिबिशन, दैट इज इनिशियल, देन लिथार्जी, ataxia, nystagmus, stupor, coma, hypothermia, respiratory failure. Now what is the antidote? So flumazenil is a specific antidote for benzodiazepine poisoning. Now poisoning due to selective serotonin reuptake inhibitors. So what will happen due to poisoning of selective serotonin reuptake inhibitor? तो ये क्या होते हैं? They are nothing but the antidepressant drugs, selective serotonin reuptake inhibitor. For example, आपका fluoxetine, paroxetine, atomoxetine, citalopram, escitalopram. So all these are the selective serotonin reuptake inhibitor. So they will stimulate the brain. Okay, CNS stimulant or selective serotonin reuptake inhibitor or antidepressant. There will be common symptoms in the CNS stimulants poisoning and selective serotonin reuptake inhibitor poisoning or antidepressant poisoning. Again, agitation, confusion, hallucination, muscle rigidity, hyperthermia, increase in the heart rate, increase in the blood pressure, seizures, etc. What is the treatment or intervention or antidotes? So आपको you have to control the hyperthermia, seizures, and you have to use of antipsychotics, benzodiazepines or ciprofloxacin. All these are the CNS depressant drugs. एंटीसाइकोटिक भी डिप्रेस करेगा, सिप्रोएफ्टेडिन एंटी हिस्टामिनिक ड्रग है, ये भी उसका एक एडवर्स इफेक्ट होता है, सेडेशन. बेंजोडाइजेपिन तो डिप्रेस करता है. इफ यू गॉट पॉइजनिंग ड्यू टू ट्राइसाइक्लिक एंटीडिप्रेसेंट, ट्राइसाइक्लिक एंटीडिप्रेसेंट का पॉइजनिंग अगर हो गया, फॉर एग्जांपल इमिप्रामाइन, डेसिप्रामाइन, अमिट्रिप्लिन, ओके, नॉरट्रिप्लिन. सो देयर इज अ माइड्रियासिस, हाइपरथर्मिया, एंड देन 3 C's मतलब क्या? कन्वर्जन, कोमा एंड कार्डियोटॉक्सिसिटी. So these are the symptoms of tricyclic antidepressant poisoning. So you have to control the seizures, hypothermia, correct the acidosis, and possible arrhythmia. Poisoning symptoms of heavy metals. So different heavy metals causes the poisoning. For example, source of that metal, signs and symptoms, and interventions or antidote. So first is nothing but the arsenic. So arsenic is the heavy metal which is mostly present in the wood, preservatives, pesticides and poison. तो एंटी पॉइजन में, पेस्टिसाइड्स में, वुड प्रिजर्वेटिव में आर्सेनिक होता है. अगर आर्सेनिक का पॉइजनिंग हुआ है, सो आर्सेनिक पॉइजनिंग will have symptoms like what are the acute symptoms after acute poisoning: gastroenteritis, hypotension, metabolic acidosis, garlic breath, आपके ब्रीथ से गार्लिक जैसा स्मेल आएगा, राइस वाटर स्टूल, टॉर्सेड एंड सीजर्स. टॉर्सेड पॉइंट मतलब एरिथमिया एंड सीजर्स. In case of chronic arsenic poisoning, pallor, skin pigmentation, raindrop pattern आपके स्किन के ऊपर आएगा, alopecia, loss of hair, shocking, glow, neuropathy and myelosuppression. These are the chronic symptoms. Now in case of arsenic poisoning, you can use activated charcoal to prevent the unabsorbed arsenic from the stomach. And specific antidote for arsenic poisoning is a dimercaprol or BAL. Then penicillamine or succimer is also a chelating agent. Now in case of iron is present in the medical for anemia, medicines for anemia, and it is also present in the parenteral supplements. So this iron poisoning is mostly common in the children. So in case of acute poisoning, what will happen? Severe gastrointestinal distress हो जाएगा, नेक्रोटाइजिंग गैस्ट्रोएंटराइटिस मतलब जीआईटी में आपका नेक्रोसिस हो जाएगा, ब्लीडिंग हो जाएगा, एंड हिमेटेमेसिस मींस ब्लीडिंग, एंड दैट लीड्स टू ब्लडी डायरिया. डायरिया मतलब स्टूल कंटेनिंग ब्लड, डिसेप्निया, शॉक एंड कोमा. नाउ इन दिस केस गैस्ट्रिक एस्पिरेशन मींस गैस्ट्रिक लैवेज, आपको पेट साफ करना है. कार्बोनेट लैवेज, कार्बोनेट से करना है. desferoxamine IV. Deferoxamine is a specific antidote for iron poisoning. You have to use that. Now, in case of lead poisoning क्यों होता है? Lead is present in the tap water, leaded paints. जो paints होता है, chips होता है, leaded paint chips, herbal remedies में, because herbal में limits दिया है आजकल heavy metals के लिए. So lead is present in the tap water, leaded paints, clips, chips, herbal remedies, gas sniffing मतलब लीड कंटेनिंग गैस अगर आपने सूंघ लिया, देन किचन वेयर्स एक्सेट्रा. देन इन केस ऑफ एक्यूट लीड पॉइजनिंग, व्हाट आर द सिम्टम्स? नॉशिया, वोमिटिंग, जीआईटी डिस्ट्रेस, पेन, मलेशी, ट्रिमर, टिनिटस, पैरास्थेशिया, एन्सेफेलोपैथी, red or black faces. Now in case of chronic poisoning, multi-system effect, anemia, decrease in the heme synthesis. Due to decrease in the heme synthesis, anemia is there. Tinnitus, न्यूरोपैथी इज देयर. रिस्ट ड्रॉप, आपका जो रिस्ट है ऐसा ड्रॉप हो जाएगा, नॉर्मल रिस्ट है ऐसा ड्रॉप हो जाएगा, रिस्ट ड्रॉप. देन मेंटल रिटार्डेशन एंड डिक्रीज द फर्टिलिटी एंड इंक्रीज द स्टिल बर्थ. सो व्हाट इज द एंटीडोट? गैस्ट्रिक लैवेज, आपको पेट साफ करना है फर्स्ट. decontamination and gastric lavage. Dimercaprol is a specific antidote. It is known as a BAL. Then EDA or succimer can be used. Penicillamine if unable to use dimercaprol or succimer. अगर आपको dimercaprol succimer यूज नहीं कर सकते तो पेनिसिलामाइन यूज करना है. पेनिसिलामाइन इज नथिंग बट अगेन आयरन चिलेटर. DTA is a iron chelator. DTA क्या होता है? hexadentate. DTA is a hexadentate. This was question in GPAT 2023. Penicillamine is unable to use, then penicillamine they are used if unable to use dimercaprol and succimer. In case of children, succimer by oral route. PO मतलब per oral. Next is mercury poisoning. Mercury is present in the different elements in the instrument. जैसे आपका ब्लड प्रेशर का इंस्ट्रूमेंट होता है, थर्मोमीटर होता है, स्पाइरोमीटर, इसमें क्या होता है? मर्क्यूरी. Now salts are used in the amalgam, batteries, dyes, electroplating, fireworks and photography. So if you got mercury poisoning, acute symptoms are nothing but the vapor inhalation, chest pain, dyspnea, pneumonitis. Chronic symptoms are nothing but the organic metal की वजह से CNS effects like ataxia, paresthesia, auditory and visual loss, loosening of teeth. So what is the antidote? Succimer or dimercaprol. succimer by oral route, and diamarcaprol by intramuscular route. Activated charcoal can be used to prevent the unabsorbed mercury. Okay. Now you can see antidote and type of poisoning again. So atropine and pyridoxine, these are okay. First one is acetylcysteine. N-acetylcysteine methionine is antidote for your paracetamol poisoning, for the acetaminophen poisoning. Atropine pyridoxine, they are used for the poisoning of acetylcholinesterase inhibitor, reversible and non-reversible. So physostigmine, neostigmine, pyridostigmine, they are known as a reversible anticholinesterase. Organophosphate, including pesticide, they are known as a irreversible anticholinesterase, malathion paraben. In case of iron poisoning or iron salt desferoxamine is there antidote. In case of digoxin poisoning, digoxin is a drug used in the congestive cardiac failure. अगर इसका ओवरडोज हो गया तो डिगोक्सिन इम्यूनोपैप, इसके ऊपर क्वेश्चन आ चुका है. डिगोक्सिन इम्यूनोपैप इज द एंटीडोट फॉर डिगोक्सिन poisoning. Heavy metal poisoning like arsenic, gold, lead. So in that case, you can have an antidote known as a diamarcaprol, known as a bulb. Oral succimer can be used. Now, in case of lead poisoning, what is the antidote? EDDA. In case of theophylline and beta agonist poisoning, beta blocker esmolol is the antidote. In case of methanol poisoning, ethanol is the antidote. In case of ethylene glycol, fomepizole is the antidote. In case of benzodiazepine, zolpidem, zaleplone poisoning, flumazenil is the antidote. In case of opioid analgesic poisoning, naloxone opioid antagonist is the antidote. In case of carbon monoxide poisoning, oxygen or hyperbaric oxygen. कॉपर का पॉइजनिंग हो गया, दैट इज नोन एज विल्सन्स डिसीज. आयरन और लीड और मर्करी का पॉइजनिंग हो गया, सो पेनिसिलामाइन इज अ आयरन चिलेटर, इट इज एंटीडोट. एंटीकोलिनर्जिक ड्रग्स लाइक एट्रोपिन, एंटीहिस्टामाइन ड्रग, एंटीपार्किंसोनिज्म ड्रग, सो इनका पॉइजनिंग हुआ तो फाइसोस्टिकमाइन इज एंटीडोट. सो एंटीकोलिनर्जिक ड्रग्स पॉइजनिंग, एंटीहिस्टामाइन ड्रग पॉइजनिंग, एंटीपार्किंसन ड्रग पॉइजनिंग, so physostigmine is the antidote. In case of heparin poisoning, protamine is the antidote. In case of warfarin and coumarin anticoagulant, vitamin K is the antidote. In case of non-specific poisoning, all oral poison except ferrous, cyanide and lithium, solvents, mineral, acid and corrosive. If you don't know the nature of poison, then universal antidote can be used, which consists of activated charcoal, tannic acid and calcium carbonate. You can order this magic bullet for GPAT Niper DI Pharmacist, read twice and qualify 100%. You can order this from my number. In every GPAT exam, every year, around 50 to 60 questions that is being covered from the theory part of this book, Fundamentals of GPAT Niper DI Pharmacist. And 30-35 questions they are being covered from this book, GPAT Cracker Achieve MCQ book. That's why it is known as a magic bullet, read twice and qualify 100%. Now it is compiled by me only, 5 times GPAT qualified author. So you will not find any 5 times or 6 times GPAT qualified person who is teaching you the GPAT and NIPA in any classes. बहुत सारे classes है market में जो आप GPAT के ऊपर YouTube के ऊपर बहुत हल्ला मचाते हैं, लेकिन उनके पास एक भी आदमी नहीं है ऐसा जो 5 बार या 6 बार GPAT qualify किया है. You can see we have very much promising results. Thousands of students they are placed in the Niper. You can also join our GPAT Niper 2024-25 online batch where you will have lectures on Wednesday, Saturday, Sunday. Live lectures will be there. Recorded lectures will be there. Lectures will be subject wise and chapter wise. Study material is available in the form of hard copy. Online test series will be there, subject wise, chapter wise, and everything is there in 8,000. And validity of this course is 2 years or 3 years. If you get all India rank below 20 in the GPAT exam, your fees will be returned in the form of reward. Thank you very much.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify 100%.